Hello, I'm Professor Manjari Tripathi, a neurologist at the All India Institute of Medical Sciences. My interest is epilepsy. So today we are going to talk about how to recognize a seizure and when to call a person having many seizures as having epilepsy. A seizure is something which is brief, unexpected, not predictable, occurs out of the blue, and is usually stereotyped in most instances. Occasionally, each episode may be different from the other and surprises not only the person who experiences it, but also the bystander who is witnessing it. A seizure occurs due to an unprecedented, excessive discharge from a group of neurons, which are tiny cells in the brain. These neurons fire excessively, synchronously at the same time to cause an excitatory manifestation and cessation of all normal activity. So virtually anything that the brain does can happen during a seizure. Broadly classified, there are two kinds of seizures, the big seizures and the small seizures. The big seizures are otherwise known as generalized seizures, and they're coming from the whole of the brain. And the small seizures are otherwise known as focal seizures, and they're coming from a little part of the brain. They don't involve the whole of the brain. Needless to say, the generalized seizures are more difficult to watch because there will be a sudden cry of the person with movements of the hands and legs, and there can be frothing from the mouth, and the urine can come out during the movement. A generalized seizure generally lasts for 2 minutes or less than 2 minutes. A focal seizure is any peculiar or bizarre activity which is out of context to what the person is doing, lasting for less than 5 minutes typically. So a focal seizure could be an eye and head deviation to one side, or it could be a phase deviation with a body deviation, or it could be just shaking of the hands and legs only on one side, the other side being normal, or it could be just a strange sensation. This sensation is known as aura. This aura consists of a feeling. This feeling could be an unpleasant sensation, epigastric rising, that is a rising from the tummy, a peculiar sensation of rising from the tummy, or it could be a déjà vu. A déjà vu is experiencing something and feeling what you're experiencing now has happened in the past. So that is déjà vu. We could also get auras or smell, peculiar smell. Usually it's an unpleasant smell of burning rubber. It could also be a sensation on one half of the body which lasts for a few seconds, which is a hemisensory aura. Or it could just be a vague sensation of not being well few seconds before the seizure. Now, this is a focal seizure. Apart from this, there can be seizures, particularly in children, where the child goes blank and does not respond to what is going on. So typically they are reading and stop reading and then start reading from another location on that page. And these children are often mistaken to be distracted and are often mistaken to not being attentive in class. Apart from that, one could have just a jerk, which is a myoclonic seizure. And one could just have a fall, which is a atonic seizure. So different seizure kinds. What is important to remember, anything which lasts for less than few minutes, typically less than 2 minutes in a generalized seizure and less than 5 minutes in a focal seizure, occurs unexpectedly, takes the person as well as the bystander by surprise, can be a seizure. It is important that the bystander notice and be the eyewitness to what is going on in the person they're witnessing the event in. It is also important to time the event. Now, the aura which I mentioned is very important, because if anybody is experiencing the aura and they know this aura is what is typical of their event, the aura is a warning. It is a warning that the person should go and rest in a safe place, should take homage of a safe place, like lie down on the sofa or the bed. In the workplace, typically there will be a sofa or a chair. So they should take homage to a safe place, and they should not be near dangerous running machinery, or should not be doing activities which can endanger anybody's life. So when there is an aura, if somebody is driving a car, they should come to the side because they're experiencing the aura, and the aura is a warning that a bigger event could happen. So the car which you're driving should be taken to the side and halted. Apart from that, it's essential that when you get the aura, you indicate to your work partner or to your colleague or to your family member that something is happening, so that they can be prepared to look after you. It's also important that when an event happens, there is an action plan which the doctor would have given. Typically, this action plan should be followed. Now, all seizures are not epilepsy. Seizures which are unprovoked are epilepsy, provided two or more seizures occur more than 24 hours apart, or a single seizure which is unprovoked occurs, and the chance of recurrence is more than 60%. So how do we come to know the chance of recurrence? The chance of recurrence will be decided by your treating doctor, who will do certain tests like the EEG, which is a painless test, and an MRI brain. If an abnormality is picked up in the EEG and the MRI brain, then a single unprovoked seizure can be epilepsy. So leave it for your doctor to decide whether the person has epilepsy or not. It's also important to remember that there are certain causes of provoked seizures, and provoked seizures are not epilepsy. So what is a provoked seizure? There are very common medications which we take over the counter because they're easily available to us. Some of them are tramadol, which is a painkiller, antibiotics, the quinolone antibiotics like ciprofloxacin, norfloxacin, which you may have just taken for a tummy upset, or you may have taken for a urinary infection. They can cause seizures. Very often in Indian medicine, we use a lot of eucalyptus oil, which is used in balms and for inhalation. So whenever we are using these agents which have aromatic oils, particularly eucalyptus oil, using it as a balm on the head or on the chest, and you're inhaling excess of it, eucalyptus oil, mind you, is a proconvulsant, and so it is going to produce a provoked seizure. There are other causes of provoked seizure which are lifestyle related. If we don't sleep for 7 to 8 hours, we are sleep deprived for consecutive days. The brain will get exhausted and hyperexcitable. The neurons will fire and there will be a provoked seizure. If you drink too much of alcohol, there can be a provoked seizure because alcohol is a toxin. If we withdraw from alcohol, if we are alcohol addicts and we withdraw from alcohol, also there can be a seizure. That's a provoked seizure. If the sodium in the body comes down, as happens in the elderly, that is also a provoked seizure. If the glucose comes down, particularly in diabetics, a seizure can happen, and that is also a provoked seizure. It's not epilepsy. And of course, if there can be an acute insult to the brain within 24 hours, there can be a seizure, and that's a provoked seizure, not epilepsy. So not all seizures are epilepsy, but what is important is that an eyewitness is available and is able to tell the doctor what is happening, so that the doctor can decide whether it is a big generalized seizure or a small focal seizure, because the treatment differs for both. I hope it has been clear. I hope we will be able to identify seizures more easily, not miss them, and bring it to the attention of the doctor so that the correct medication can be prescribed and the person can get back to life as normal and work at the usual workplace. Thank you.